Hi guys, it's Teresa, the Dental Assistant Tutor. Today I am uploading a video to show you and go over the exam for the radiology / ICE part of it. The infection control protocol that you will need to know for the dentist's office and to pass your ICE exam through DANB. I will use a couple reference books that I will leave the link below that I personally use to study for my CDA. I also am going to use a few slides that I've used for my students to pass their exam, and they have passed it with just that simple slide sheet because it gets straight to the point and what you need to know. I'm going to use props so I can show you and demonstrate, because some students learn by textbook, some learn by someone telling them, and some learn by props. So whatever is going to help you, I am going to use. Grab some paper, pen, pencil, and maybe something to drink, a snack. You know, I can't see you, but you can see me. I will have a drink or so just because this course is going to take a minute, because I want to teach you as if you were sitting in my classroom. So while you're waiting, go ahead and get your stuff. And like the video down below, please, and subscribe. This is going to take maybe about 40 minutes, give or take. You can pause it, you can rewind it, you can come back to it. It will be on my Dental Assistant Index page, which is the dentalindexjunior.weebly.com. I will leave the link below for that. Also, once you are finished with the course, I have a graduated link, which is the dentalindex.weebly.com, and that will take you to things that you would need to know if you become an office manager, or if you are the front office, or you just need to do an order. There are all kinds of things on that page that will help you, including if you are looking to switch jobs, or if you get the question, what dental program do you know for software and computers, and you don't know any, then look at my links and there will be tutorials for you to learn and do what you're doing right now. Take notes. Okay, so let's go ahead and get started. We're going to go over the key terms that they want you to know. If you do not know what they mean, please look them up later on. I will also upload some slides for you guys. Aerosol, asbestos, biological monitoring, cross-contamination, decontamination, high-level disinfection, immunization, intermediate level disinfectant, pathogens, personal protective equipment, sepsis, sporicidal, sterilization, tuberculosidal, universal precaution. Now, if there's any words that you cannot pronounce, like I tell my students, download the app, pronounce it. It's a free app, and there will be words that you cannot pronounce. There are still words I cannot pronounce. Okay, so modes of transmission, disease of transmission. And remember, just pause it if you have to take notes. Infection microorganisms may be transferred by various methods. Direct contact, touching it. Indirect contact, inhalation, aerosol droplets, contaminated food or water, cuts or breaks in the skin. Now I'm going to go back and forth, so that's that. Let's talk about cross-contamination. Can occur if appropriate methods of sterilization, disinfectant, and waste disposals are not practiced. Cross-contamination, meaning, you know, if you don't wipe down with your sterile wipes, if you don't wipe down with your disinfectant wipes, maybe the syringe itself that you use for etch or composite, but you take the tip off and you switch it out, which you're supposed to, you can you can cross-contaminate. So if it's not wiped and you touch something else and then you touch that again, you're cross-contaminating. Okay, remember that. That will be on the exam. Universal standard precaution. Universal standard precautions implies that the same infection control procedures must be used for every patient. So, every patient, remember that you do not know if they have anything. Alright? Integrate and expand universal precautions to include organisms spread by blood and also body fluids, secretion, excretion, except sweat, whether or not they contain blood, non-intact broken skin, and mucous membranes. Okay, so my slide says the same thing as my book. Alright, let's see here. Medical history data. Universal standard precautions implies that the same infection control procedures must be used for every patient. Okay. Medical history data. I know I just said that. Blood and saliva from all dental patients are considered potentially infection materials. Used on every patient. Check each patient's health history. Medical history data. Review patient's medical and dental health history information prior to the beginning of each treatment session. So they might ask you on the test, when should you check the health history? Prior to treatment, before you even touch that patient, because you don't know if they're allergic to latex, the anesthetic, red dye number 4 for topicals, so keep that in mind. Health status of each is determined by the health history. Include current questions relative to HIV and HBV. Collect and record the data relative to medications and laboratory reports. Include antibody test results for infectious diseases. Let me cross-reference, guys. Elements of standard precautions. This one says hand washing, use of gloves, mask, eye protection and gowns, patient care equipment, environmental services, and injury prevention. Hepatitis B vaccine. Immunization is the best protection against the hepatitis B virus. I also got the hepatitis A vaccine because I remember when I first started out in the early 90s that, yeah, I'm that old, but in the early 90s, and that's when HIV became very well known and a chance to get it, and I had nightmares. So I decided to go ahead and you can't get a vaccine against that, but I did get the A. And I'm glad I did because things are starting to rapidly increase. But with you taking the time and being careful and following the instructions the way CDC guidelines are, then you will be safe. But the problem is, in today's society and in the dental practices, we're getting lazy. And we cut corners. And you're considered, a goody two-shoe if you do too much of the right thing. Well, don't worry about that. You're protecting your patient and you're protecting your health. Number 1. Alright. Let me get back, right? Hepatitis B, HBV, can be transmitted through accidental needle sticks. HBV can be found in other body fluids such as saliva, tears, semen, and vagina fluids. Now, there's more information on this one that I want to share with you about that. HBV. Concentration of HBV in body fluids. It's very high in the blood, the semen, and the wounded exudates. That's what it says on this one. Moderate, it has semen on top, again, vagina fluid, and saliva. Rethink, right? Okay, I'll behave. Low/not detectable, urine, feces, sweat, tears, and breast milk. So it's there, but it's not detectable if the patient is carrying it. Okay, this is important. Potential routes of transmission of bloodborne pathogens, meaning the disease. Patient can give it to the DHCP, which you need to know that is the dental health care provider or practitioner. Okay? The DHCP can give it to the patient. There are people working in the office that are carrying diseases around. Okay? Don't be naive about that. And then patient to patient also. So that means the cross-contamination part, patient to patient. Average risk of bloodborne viruses transmission after needle stick. When it comes to the HBV source, and it has the HBsAg and the HBeAg, and you'll see that on the slide, 22% to 31% clinical hepatitis, 37 to 62% serological evidence of the HB infection. Then there's other ones, HBsAg star and HBeAg star, 1 to 6% clinical hepatitis, 23 to 37 serological evidence of the HBV infection. HCV is 1.8 and HIV is 0.3. Preventing transmission of bloodborne pathogens. Bloodborne viruses such as hepatitis B virus, HBV, and hepatitis C virus, HCV, and human immunodeficiency virus, HIV, girl with speech problem. I used to get a Fruit Loop for every time I got a word right. Wonder why I have a weight problem. Anyway, just trying to make some fun out of this. Let's keep going. Please like this video. Alright, factors influencing occupational risk of bloodborne viruses infection. Frequency of infection among patients. Risk of transmission after a blood exposure, type of virus, and type and frequency of blood contact. Going back to my book. Personal protective equipment and barrier techniques. And take a sip, guys. Have something to drink. Hooked on energy coffees. Teachers do a lot. Give a shout out to your teacher at some point when you're done with school. Makes them feel better. Okay. Personal protective equipment and barrier techniques. Personal protective equipment, PPE, is to be worn by employees to reduce the risk of infection control disease transmission. Disposable face mask, protective eyewear or face shield, disposable gloves, clinical jacket, and lab coats. So the rule of thumb is you're supposed to have your arms covered when you're performing procedures. But not everybody does that because, you know, I was guilty of it too, because you would have hot flashes if you're in your 40s. So, and just some young adults get hot flashes too from all those hormones rushing. So I want to go over real quick something I've learned actually years later, and there's a lot of dental professionals that do not know this unless they took the CE course. There's a lot of things you just keep on learning in dentistry. So I have a face mask right here, okay? And you probably already know this, but I'm just have to review for those that don't, okay? So have a snack or something. But the face mask has a wire right here, and some have 2 wires. You would put it on your nose, color side out, put the loops on, pinch it here, and twist like that. And then pinch it here, and twist like that if you like. Well, no, not that way. Just like this. Okay. It's weird when you're at home doing it yourself. I'm trying to get the thing right. Okay, anyway, focus. So, close here, and then pinch here, like that. Now, some people want to take it and do a figure 8 and loop it. So, it looks like that. Okay, well, there's a little opening now that the aerosols can get into. And when you're using electric surge, the smoke, oh, if you can smell it, you can taste it. Remember that. Keep your mouth shut during those procedures. Okay, so you want to do that. And then you want to wear your rubber gloves. But before I put those on, you want to have clean, washed, dry hands. You want to have your safety glasses on, which I didn't grab in time, but that's okay. And then let's talk about gloves. You want them on, okay? You don't want them too tight or too loose. If they're too loose, you can't grab things that are small, okay? You could drop it. If they're too tight, that's for you, because then you'll get carpal tunnel, okay? Learn from me. I found this out years later. If your gloves are too tight, you're going to get carpal tunnel. So make sure you have the right gloves. I'm going to put both of them on. And if you have glasses on, remember I'm at home, not at a dentist's office, but if you have glasses on, what you're going to do is you're going to make sure you put your glasses on first, your mask, wash and dry your hands, and put your gloves on, okay? And to take them off, you're going to, so you don't touch your skin, you're going to grab it right here, okay, like this. You're going to turn it inside out, so all the blood and spit and saliva is on there. Take this one, do the same thing, and then you throw it away. Now sometimes what I do is I will take all the cotton products that might be too saturated and grab them, okay, and then turn it inside out in my glove. So I know it's in the wastebasket, and it's not going to get touched by anything. If for some reason you got to go in that trash can, and sometimes you'll have to because someone will throw something away, you want to know that you're protected, okay? Wear gloves when you do that too. Common sense, but you never know. Let's see here. Okay, hepatitis B vaccine. A little bit more about that. Your employer should offer that to you the first week you get hired. But if for some reason they do not, you have to bring it up to their attention. But they'll probably ask you during your interview. And I suggest that when you have an interview, you'll have like a portfolio, and on the second or third sheet, you'll have like your resume, your personal reference and business reference already printed out for them so they don't have to make a copy. And then on the next, have your hepatitis B vaccine or your shot record, and have some copies so they can have it, because every office should have their staff members' shot records on file. In OSHA, or like for our state of Tennessee, TOSHA walks in, they're going to want to know that everybody signed the MSDS book, which is now called the SDS book. Also, they want to make sure that you have your vaccinations, or there is a sheet to waiver that you do not want to have that, because some religions say, you know, you can't get vaccinated, so that could be one. Just a little background history on this. Transmission of HPV from an infected dental health care provider to patient. 9 clusters of transmission from dentists and oral surgeons to patients, 1970 to 1987. 8 dentists tested HBeAg were positive. Lack of documented transmission since 1987 may reflect increased use of gloves and vaccine. 1 case of patient-to-patient transmission in 2003. HCV infection dental health care setting. Prevalence of the HCV infection among dentists similar to that of the general population, 1% to 2%. No reports of this see the spatter? I'm sorry. I'm a funny teacher. Alright, no reports of the HCV transmission from the infected DHCP to patients or from patient to patient. Risk of HCV transmission appears very low. Transmission of HIV from an infected dentist to patient. Only one documented case of HIV transmission from an infected dentist to patient. No transmissions documented in the investigation of 63 HIV-infected HCP, including 33 dentists or dental students. Just starting out. Gotta be careful. Okay. Risk factors for HIV transmission after precancerous exposure to HIV-infected blood. CDC case control study. Deep injury. Visible blood on device. Needle placed in artery or vein. Terminal illness in source patient. Exposure prevention strategies. Engineering controls, work practice controls, and administrative controls. Engineering controls. Isolate or remove the hazard. Example, sharp containers, medical devices with injury protection features, self-sealing needles. Alright guys, so back to the props. This right here, okay? Now, you can take this off and put it in the sharps container. If you have a regular anesthetic syringe, you would take the needle off in the carpio and you would put it into the sharps container as well. I would also like to talk about your endo files. Those would go into your sharps containers if they become bent. Alright? Like that right there. See how it's bent a little bit? Okay, it's not going to be able to reach the apex. Sometimes the dentist can sit there and straighten it out like that. These are clean, never been used on a patient. They're just for showing and telling. That could be put in the sharps container. Let me see here. When they're talking about devices, that it could be transmitted patient to patient. It's talking about right here. So you want to make sure that you take your wipes and always wear gloves, okay? My favorite's the side wipes, but these are Cavi wipes are also another popular one, because on the back you want to read it when you can at the office when there's downtime, and there are downtime moments. So always look like you're doing something, keep yourself busy. But it tells you the bacteria it kills, the pathogenic, drug-resistant bacteria, the envelope viruses, all the different viruses that it kills. Make sure it kills HPV and HIV. When you're placing an order, you don't want to order like just Lysol. You want to order the stronger stuff when you're cleaning the room. If you just can't seem to get an order because of your dentist and the budget costs, which I hope that's not the case, but that can be the case, then you want to do 50-50. The bleach, household bleach, hydrochloride they call it, and then the water using a spray bottle. Spray wipe method. So make sure you wipe these things. And also, for the dentist's sake, try to keep your rheostat nice and shiny, okay? You want it to look like a reflection on you, like, you see the handprints? I'm using that for an example. Yeah, I gotta finish my ceiling, guys. See that? So, we're carpenters. House is never complete. But anyway, you want to make sure you clean all that. And your air water syringe tips, either they are the metal ones that gets autoclave or the disposable ones, okay? Okay, let me continue on. Sorry for that background noise. Pop-ups on the bottom of the screen. Oh yes, in your carpiols. Okay? You want to make sure that you throw these away because sometimes there will be blood in them. Put them in a sharps container. Also, about that, if you have any burrs, they should go in the sharps container. Make sure you try to learn your burrs once you get into an office. Some dentists have some favorite ones. Let's see here. Personal protective equipment must not allow blood or potentially infection materials to pass through to the clothing, skin, or mucous membranes. Change disposable face masks for each patient. So after every patient, change your mask. That is on the exam. Like I teach my students, there's the real world and then there's the book world, okay? What you're going to want to do is some doctors don't want you switching them out after every patient, okay? Never keep them in your pocket because of the aerosol. It can get into your pocket and contaminate it. And then you might put the contaminated side towards your mask and you just breathing it in. So don't do that, okay? Also, I have a lot to teach you. Hang on a second. When you're wearing the mask, make sure that the dentist, when you're changing them out, that if it becomes wet or soiled, even if you sneeze in the middle of a procedure, you have to change it because once it becomes soiled, it's no longer good, okay? And there are different levels of it just came to me. There's so much information I want to share to you guys. You guys are going to ace this test. But there are different levels of mask and gloves. So when you're ordering them, level 3 is the best because it's showing that it's very secure, okay? And keeping you from getting any type of aerosol or anything going through your gloves. Level 3 is the best, but that means it costs more. And that's why some doctors don't want you to switch it out after every patient. So remember that. That's up to you guys. But for your exam tests, after every patient. Some doctors are cheap. Just sorry to say if any dentists are watching this. And some, go ahead, change them out. Protective eyewear or face shield, not just for you, but for your patient, okay? And you should have if you wear regular reading glasses and stuff like that, a lot of people don't want to do it, but you have those side shields that you need to wear, and I'll leave the link below if you need those for just regular glasses. They're cheap. You wipe them down. You can cold soak them for 10 hours if you want, but that aerosol, okay, even though you're going to look kind of geeky having them, nowadays we can't be too safe, can we? And it can go into your eye. And then what? You got herpes complex in your eye. Okay. That's attractive. Alright. So, change disposable face mask each patient. Wet or soil. Eyewear at all times. Imagine there's some that movie, If Saliva Was Red, and it shows saliva all throughout the operatory, but if it was red. So it stood out, and if it was mist in all the areas that it could be. So when there's downtime, deep clean your treatment rooms. Replace disposable face masks. Protective eyewear should be worn at all times. Protective eyewear protects the eye from flying debris and contamination. Protective face shield should be used during clinical procedures that produce aerosol sprays. Not everybody does that. It's the full face shield. Not everybody does that. Disposable gloves reduce the potential for cross-contamination in the dental office. Gloves that are torn or punctured should be discarded and replaced. The handpiece can catch your glove, and a lot of times the dentist, so be ready to give him a quick glove. That's your job. Gloves worn for treatment or for examination must be changed between patients. Sterile gloves are recommended for periodontal and oral surgical procedures. So you can't order sterile gloves. And like sterile gauze, Don't waste your money on that. Just take some of your gauze that you have, put them through the, where is one? Here it is. Sterilization bag is what I'm looking for. But you would put it in a sterilization bag and make sure that all the extra gauze that's in there will, what is it? My desk is not that big. Okay, so you would put the gauze into the sterilization bag, seal it, and when you seal it, I'll use this for an example, even though it's not it. You just want to crease it right here at the very tip. You do not want to take that sterilization bag and go down like this and then seal it, because there'll be an air pocket right here that it can become unsterile. So you can sterilize gauze. Keep that in mind. If your dentist asks what you're doing, you just look like you're saving him money and you're doing a great job. So let's see here. Okay. Contaminated person protected equipment must be placed in an appropriate designated area or container for washing and decontaminating or discarding. Protective barriers are used to cover surfaces and equipment such as light handles or X-ray unit heads. Plastic covers used to protect surfaces must be replaced when contaminated. Surfaces not covered by protective barriers must be cleaned and surface disinfected with an approved EPA intermediate level disinfectant. This stuff. Or decide. Now, what I want to talk about here is, I always, as an assistant, what I did, and you're rushing, I know, but what if it was your loved one in the chair? What if it was you in the chair? How would you feel? That's how I always thought about it. So let me slow down for a minute and tell you what I did as an assistant. And it probably won't be on an exam, but it's important. I would always put my barriers on, the light covers wherever I could, even the switch for the light. And I've seen dentists use tinfoil for the light handles. I've seen dentists use sandwich baggies and you just do like a figure-8 twist onto it. And then they actually order the supplies. That's their office, however they want to do it. If it helps give you guys raises, I'm working on that for you guys. But going on with that, you want to always make sure it's covered. And then when I uncovered it, technically you don't have to wipe it, but I still wiped it. You know what I'm saying? Because you don't know if there's any holes and you want to make sure that it's really clean. So when you cover the handpiece tubing line, when you cover the air water syringe handle part, come on, we use that so much. Or your suction, when you're doing the HVE and stuff like that and you're flipping it on and off, make sure that you wipe all that really good. I worked at one office that we had to take the whole hose off, and they all can be disconnected. The tubing itself, any tubing can be disconnected from the unit, okay? And it could be trimmed, replaced. But one office had me use soft scrub and put it inside and use a brush and scrub it, okay, to keep the biofilm down and all the bacteria. And just so you know, your suction trap should be used one time and thrown away. Even the main suction trap, it's a bigger trap. Some are kept in basements. I actually worked in an office in Clinton, Tennessee, that actually had me scrub with a toothbrush in the patient or our employee's bathroom in the toilet, the main suction trap. Really? Some of the things, if a dentist is watching this, that we go through as an assistant. So, and then some buy a whole case and just take a brand new one, put a lid on it, and replace it. It's just a twist. If you know how to do that, add it to your resume. Let's see here. High volume oral evacuation system minimizes the formation of aerosol during patient treatment. Pre-procedural rinse and pre-brushing is recommended for patients prior to treatment to minimize bacteria counts and reduce aerosol contamination. That's out of my book. It's also on my slide that you can look at. Use of a rubber dam for clinical procedures reduces aerosol contaminations. A lot of patients do not like the rubber dam because when they have it on their face, okay, like this, and you got the wire, well, it's hard to breathe. So what I would do is I would fold this when I'm hooking it to the rubber dam frame, or when you have it like this, you can cut it right there with your crown and bridge scissors. They're your universal scissors for everything. So I would use that. And then when you're suctioning, make sure you have it right next to the tooth or the tooth next to that, okay, to keep the aerosol sprays down. And another thing I would do is when the doctor is adjusting maybe a denture, or not everybody does this, so they're doing a denture adjustment or they're adjusting the crown, you know, I would always take my high volume, and while they're drilling outside the mouth, I would just hold the suction there in the air. And so instead of the debris going up in the air, it would just go right into the HVE. So remember that. They'll be appreciative of that. Plus you're protecting their eyes a little bit more. Hand washing. Before placing gloves, hands should be washed thoroughly with a liquid soap. Surgical procedures require the use of standard surgical scrub. Hands, wrists, and arms up to the elbows are scrubbed with an overlapping circular strokes and significant soap lather. Okay, so lather up, you know, get right here. The most common places to miss is right here and your wrists. So make sure you get that nice and clean. There is some slides in here that I do want to read about hand washing. Bear with me. Hand hygiene. Hands are the most common mode of pathogen transmission. So this might be like, why is hand hygiene important on a ICE exam? You would do, hands are the most common mode of pathogen transmission. Reduce spread of antimicrobial resistance. Prevent healthcare associated infection. Hands need to be clean when visibly dirty. That's what you're studying about, but I would also wash my hands even when I don't see dirt. After touching contaminated objects with bare hands, before and after patient treatment, before glove placement and after glove removal, definitely. Efficiency of hand hygiene preparation and reduction of bacteria. Plain soap does a good job. Antimicrobial soap does a better job. The best to use out there is alcohol-based hand rub. So, you know, the Perel and Perex or whatever, Perel shampoo ain't it, Perex, whatever, anyway, those little foamy things you see at the office. I'm having a brain fart for some reason. But anyway, this is a boring lecture, but you need to know this information, so I'm just doing it for you guys. So you would just put it on there. They say the rule of thumb is you use it up to 8 times and then you wash your hands. That is not in the books. That's just something I've been taught. But I always thought the best method was to just wash your hands. But it actually is the alcohol base because it's killing the bacteria. But I would do both. Can't be too safe, right? Hand hygiene definition. Really? Hand washing. Wash your hands with plain soap. Antiseptic hand wash. Washing hands with water and soap or other detergents containing antiseptic agents. Alcohol-based hand rub. Rubbing hands with alcohol-containing preparation. Surgical antisepsis. Hand washing with anesthetic soap or an alcohol-based hand rub before operation by a surgical personnel. Alcohol-based preparations. Benefits. It's rapid and effective in antimicrobial action, tongue-tied, improves skin condition, more accessible than sinks. Limitations. Cannot be used if hands are visibly soiled, so if they're wet, dirty. Store away from high temperatures or flames, or you're going to cause a fire. And just, I have to throw it out there. I'm teaching as if you're in my classroom. Just saw that Pam, the spray, the bacon thing, have been exploding on people, and this poor lady got burnt all this way. So be careful even in your own home, okay? Hand softeners and glove powders may build up on your hands, okay? And which means what? Just like chipped nail polish, it's going to attract germs. Special hand hygiene considerations. Use hand lotions to prevent skin dryness. Consider capability of hand care products with gloves. And I have some on my pages too. Keep fingernails short. Avoid artificial nails. It doesn't say you can't have them. It just says avoid. And I know some of you girls like to use those nails. But just think about it. Avoid hand jewelry that may tear gloves. Okay? And rings can rip your gloves, so be careful. And you don't need to take your rings off because you might lose them. You won't really have time to do that, even though that's what you say you should do. Let's keep going. Latex hypersensitivity and contact dermatitis. Contact dermatitis. Irritant contact dermatitis. Not an allergy. Okay, so dermatitis is not an allergy. You're not reaction to it. But your skin becomes dry, itchy, and irritated areas from over and over repeat. Allergic contact dermatitis is a type 4 delayed hypersensitivity. So remember this. You got irritant contact dermatitis, and you got allergic contact dermatitis, which is a type 4. Allergic 4. That's the one that has a number. Delayed hypersensitivity may result from allergy to chemicals used in glove manufacturing. So it's not even what's in the office, it's just what the company that's making the gloves is using. Sterilization and disinfectant of patient care items. Latex allergy. Type 1 hypersensitivity. Oh, sorry, it's jumped around. Type 1 hypersensitivity to natural rubber latex proteins. That's a latex allergy. Reaction may include nose, eyes, and skin reaction. More serious reactions may include respiratory distress, but not rarely shock or death. So you're not going to die from it. It says rarely. So, I mean, unless it's really bad. Now, let's talk about that. You're getting your gloves. Make sure you're checking the health history that the patient's not allergic to what? The rubber dam made out of latex. Make sure if you have latex gloves that they're not allergic to the latex. Make sure if you're using topical that they're not allergic to red dye number 4. But I'm getting off track with that. I want to stick with the latex allergies. Okay, also let me talk about gloves. Sometimes when you're working, okay, you'll see etch and it might drop onto your glove. It will go through your glove. You don't see it go through your glove. I'm telling you from experience it goes through your glove and it starts to irritate your skin tissue, okay? Because remember, if you're doing in-house whitening or if you're bonding brackets or doing composites and you get etch on the patient's gums, it's going to bleach it white. And it will go at least up to 72 hours for it to go away. So same with wearing gloves and you see people put stuff on their gloves. It can go through your gloves, so be careful. Check those levels, remember, when you're ordering those products. I like to give a shout out while I'm thinking about to Darby Dental. Rebecca, she is on my Facebook page. I will leave, she's actually on my Weebly.com page too, so check her out, okay? She'll help you with your first order if you need help with it. Okay, critical instruments. penetrate mucous membranes or contact bone, the bloodstream, or other normal sterile tissue. So anytime it is open up into the bone or bloodstream, that is critical. They must be heat sterilized between uses or use a sterile single-use disposable device, okay? So back in my day, they had the metal suction tips, and now they have the disposable ones. So if it's when you're doing surgical suctions and the blood, you do never reuse these. I've walked through working interviews, and I've seen dentists reuse impression trays that they shouldn't be reusing. In HVEs, they put them all in the cold sterile, and yes, I can tell they were used because they have adhesive and alginol stuck in there, and they're just being cold sterile, and they're supposed to be thrown away. Now nowadays they do make impression trays that I have on my page that are reusable plastic impression trays, and I love them. So if you're practicing at home impressions, and they're heat sterilized, so, and if you're at home using them, I would boil them. That would help them for so long, and then disinfect them. If you're practicing on a mom or a husband or something, get those impressions good. Okay, let me keep going. Semi-critical instruments. Contact mucous membranes, do not penetrate the soft tissue. So critical penetrates the soft tissue. Semi-critical instruments do not penetrate. Heat sterilized or high-level disinfectants. Same thing. They both get heat sterilized or high-level disinfectant. Examples: dental mouth mirrors, amalgam condensers, and dental handpieces. Okay? Those are semi-critical. So you have semi-critical handpiece, okay? It's in the mouth, it's getting splatter on it, but it's not cutting the tissue. The burr is, so that would make it what? A critical. But a semi-critical, no. And mouth mirrors, let's talk about that. These are semi-critical. And with the plastic ones, you would go ahead and cold sterile them for up to 10 hours. Unless when you order them, you read, always read everything, you read that they are sterilizable. Okay, if they're not sterilable, if you can't autoclavable is what I'm trying to say. If they're not autoclavable, then cold sterile them for up to 10 hours. Don't put them in for 10 minutes and come back after lunch and change them out, okay? The metal ones can sterilize. And the heads on the metal ones can be interchangeable. Exchange them out when you can buy a box for your office. You can exchange them out to help with the scratches on the mirror, because the dentist wants to see a good, clean mirror. You're his windshield wiper. Remember that. You're keeping it clean from debris. So use your air and water at times. Remember, my students. Let's see here. Non-critical instrument and devices. Contact intact skin. Clean and disinfect using a low to intermediate level disinfectant. Example: the x-ray heads, face bows, pulsometer, blood pressure cup. You can't put that into an autoclave, so you have to wipe it down. Okay? Non-critical. Automated cleaning, which would be an ultrasonic cleaner, an instrument washer, or a washer disinfector. Nowadays they have those machines that look like a big dishwasher, and you just load your instruments up in there. But I still suggest, if you have very contaminated instruments from surgeries, even before you put them into that unit, that you put them into an ultrasonic unit. And yes, I do have one of those, thanks to a dentist providing it. If there's any dentists watching this video and you're intrigued to donate to my classroom, that would help. I must provide everything for the school. But anyway, you would put it in there, and let me talk about that real quick. One of my pet peeves, going into an office and seeing the lid off. Okay? Just a moment to put it on, guys. Just put that lid on, okay? Because the aerosols are going up in the air as you walk by the sterilization area. Or if you're in the sterilization area, just talking away, chatting away, and the lid's off, you're breathing all those germs in. Remember that. Okay. Liquid chemical sterilant disinfectants. Only for heat-sensitive, critical, and semi-critical devices. Powerful, toxic chemicals raise safety concerns. Yeah, let me talk about that. Remember, I started in the early 90s, okay? I just started reminding my dentist who was older, Dr. Leisman, God rest his soul, I'm sure. But, I used to remind him, put your gloves on. He would forget to put his gloves on. So, and I wasn't always taught, like, I had great instructors, but there are some things that you just are taught the wrong way. And back in my day, we would just take our hands sometimes because the solution's killing the germs that you tried on impression trays. Just trying them in and disinfecting them is fine. You know, sterilizing them for 10 hours. But once just to try a tray in. So make sure you learn your sizes and just judge by the patient's mouth. But anyway, I'm getting off the track. When you're trying this in and then you go sterilize it, do not go in the next morning to take them out thinking, oh, well, it's killed all the germs. Well, and that's how I was taught, because it's going through your skin. Yeah. It's going through your skin and it's affecting your body. Okay. And I ended up with fibromyalgia. Okay. And I don't, how, what, why? So with that, you know, things can go through your skin. All those times etch got on my skin. Or how about all those times, you know, people played around in the classroom and thought, hey, well, we're learning radiology at this one school, because I taught at all these different schools, you know, let's push the button. Well, all that is staying in your body. It's a latent period. Okay? So remember that. Anyway, I'm going to keep going. I just want my students, they know how I teach, you know, to really know everything. And that's why they're getting hired. And, you know, God bless. Okay, so storage of sterile and clean items and supplies. Use date or event related self-life practices. Examine wrapped items carefully prior to use. When packaging of sterile items is damaged, re-clean, re-wrap, and re-sterile. OSHA, TOSHA, wherever you live, they will be checking drawers to see if there's any instruments open, just laid out for easy access, and that is a ticket. That is a fine. So make sure everything is wrapped up. That should be wrapped up. That's going to be used in the mouth. Okay, so use that for knowledge. If it's going to be used in the mouth, it should be wrapped up. Okay, if you pre-make your trays, make sure they're covered and put in a cabinet or drawer that cannot be opened during procedures, so you're safe. Okay. Environmental surfaces may become contaminated, not directly involved in infection disease transmission, do not require a stringent decontamination procedure. Okay? When in doubt, wipe. Okay, the storage, let me go back to that. I read all that. Okay. Categories of environmental surfaces. Clinical contact surfaces. High potential for direct contamination from a spray or splatter or by contact with the DHCP's gloved hand. So these are categories of environmental surfaces. The clinical contact surfaces, talking about what? Some examples, if I could hear you, would be your unit, your assistance cart, you know, the countertops behind you, most likely there's a countertop. Housekeeping surfaces. Do not come into contact with patients or devices. Limited risk of disease transmission. Okay, and just so you know, some dentists will pay their assistants to clean the office and cut out the cleaning person. I used to take a break from dental and I would clean houses, and who best to clean? people that are, you know, organized like that, and that's good money. And I would make $100 to $200 cleaning the dentist's office, depending on who I worked for. One dentist paid me $80 every time I cleaned the office every 2 weeks. It should really be done once a week, and from top to bottom, it's a lot of work. So I would at least ask for 150 to 200 to clean an office, because most people charge 300 or more to clean the office. And it could be separate from your paycheck. Anyway, just thought I'd throw that out there to help you make extra money and make this video not so boring, because we're 55 minutes into it. But who's watching the clock? So let's keep going. Cleaning clinical contact surfaces. Risk of transmitting infection greater than for the housekeeping surface. So the risk is transmitting infection greater than for the housekeeping surface. Surface barriers can be used and changed between patients. Okay, remember that. They can be changed, but sometimes you have to wipe them, or just do it like I did and did it every time. Clean and disinfect using an EPA registered low HIV/HPV claim to intermediate level tuberculosis claim hospital disinfectant. Okay, and the clinical contact surfaces, now that I got a picture I will show you, is the patient's dental chair. And let's talk about that. You want to clean from the head to the feet. A lot of people don't want to clean the feet area, but especially wintertime, you got men coming with work boots, and then you got a lady that comes in heels, and then if their outfit gets messed up, they're going to look at you while you're not cleaning it. Physical removal. Oh, wait, let me keep going here. The tray that you actually put your tray on, if you have one of those operatories, door handles, the countertops, the cabinets, all that. The amalgamator machine. General cleaning recommendation. Use barriers. Let's review. Use barriers. Physical removal of microorganisms by cleaning with a disinfectant process. Follow manufacturer instructions for proper use of the EPA, which is Environmental Protection Agency. Register hospital disinfectants. Do not use sterile high-level disinfectant on environmental surfaces. Do not use sterile high-level disinfectant on environmental surfaces. Okay, and that's like your dental chairs. Some dentists want you to use Armor All to clean those chairs. And baby oil works great, but if you're going to use that, I'm talking very little, and you wipe it, or even household polish works great, but cleaning all those surfaces, keeping them nice and shiny. If you have plants in the office, make sure they're clean, the dust, anything with dust, even spider webs up above. You want to have the patient sit in that dental chair and be able to look at that operatory light that frequently gets missed. And if you see any splatter up there, you need to check it after every patient and use a microfiber cloth to clean it, because you can ruin it. And if you take the little latches on the operatory light, the two little latches, most of them have that, and take the middle piece, don't touch it, it'll be hot, touch the middle piece, pull it down. You can wipe the inside, because sometimes they can get contaminated, because patients, they're looking around and that's the first thing they're looking at, and if it looks dirty, God knows how the instruments are, right? I would like to cross-reference in my book here. Drop something.